Great. So welcome. You have joined the Request for Proposals Applicant Information session for the Country Innovation Platform Ghana pilot. This is a collaborative initiative with the Ghana Health Service, USAID Ghana Mission, USAID Center for Innovation Impact, Grand Challenges Canada, and AMP Health. And we are thrilled that you're joining us today, hopefully because you are interested in learning more and potentially applying to this request for proposals. So my name is Dominique LaForest. I'm the portfolio manager of the STARS and Global Health portfolio at Grand Challenges Canada. We'll talk a little bit more later in the session about why I am hosting today's information session and the role of the STARS and Global Health portfolio within this initiative. I did also want to say Eid Mubarak to those celebrating today. Apologies for the poor timing of this session on a holiday. But again, we thank you for joining us. And so let us move on to today's session agenda. So today we are going to cover an overview of the problem that this initiative is seeking to address. We're then going to move on to an overview of the Country Innovation Platform Ghana pilot, the Country Innovation Platform Ghana Partners, and then the role of the STARS and Global Health program within this partnership. We'll move on to covering the request for proposals focus areas and anticipated outcomes. Then we'll talk about the key funding details and deadlines. We'll cover some details about project eligibility, and then we'll do a quick overview of the screening and review process. Finally, we'll finish off with some application tips before we get into the open question and answer period. And before I jump in, I just want to sort of give a reminder and a caveat that this session is not meant to replace a thorough review of the RFP or the FAQ documents. So please do still go to the STARS and Global Health webpage that will be linked at the end of this presentation to ensure that you're doing a comprehensive review of those key documents. So, over the past few decades, Ghana has made considerable progress in reducing maternal and newborn mortality. However, the country still faces many challenges in ensuring that mothers and newborns receive high-quality health services. The Ghana Health Service, alongside the CIP Ghana Partners, identified maternal and newborn health as a priority area of focus for the Country Innovation Platform. Following this early narrowing, the CIP Ghana Partners, led by the Ghana Health Service, engaged stakeholders from across the country representing diverse groups within the health ecosystem. These stakeholders were brought together in February of 2023 to participate in a 3-day co-creation workshop that served to identify some of the key health challenges in maternal and newborn health that participants believed could benefit from innovation and which should become the focus of this CIP pilot. These identified and prioritized challenges are as follows. First, poor access to quality MNH services, especially in rural and underserved areas. Second, low levels of skilled birth attendants and emergency obstetric care. Third, limited availability of essential medicines, medical supplies, and equipment. Fourth, weak referral linkages between health facilities for maternal and newborn health services. And 5, inadequate emergency transportation for patients in need of emergency maternal and newborn health services. Overall, Ghana aspires to eliminate avoidable maternal and neonatal deaths and recognizes the role innovations can play to improve MNH in Ghana, and in so doing, contribute to achieving their bold ambition. So, what is the Country Innovation Platform Ghana pilot? In an effort to meet their MNH goals, the Ghana Health Service, in collaboration with the United States Agency for International Development, Grand Challenges Canada, AMP Health, together considered the CIP Ghana Partners, And other collaborators across the health ecosystem have launched a country innovation platform in Ghana to identify health challenges that could benefit from innovation and support local innovators who can respond. The CIP Ghana seeks to contribute to the Ghanaian health ecosystem by testing innovative solutions that have the potential to improve health outcomes, generating lessons learned about how to design an innovation process that is tailored to locally defined needs, and demonstrating the feasibility of a platform for countries to support innovations and invest in an ecosystem of informed and connected local health innovators. Supported by its partners, the CIP Ghana has already engaged stakeholders in Ghana in a human-centered design process to define this call for innovations. This is the 3-day co-creation workshop I mentioned earlier. This request for proposals will enable the CIP Ghana to mobilize crucial resources and work to address these critical needs by identifying relevant innovators with transformative ideas at proof of concept stage that could help address the key identified challenges in maternal and newborn health. So who are the CIP Ghana partners? The CIP Ghana pilot is being led by Ghana Health Service, with each of the 3 other core CIP Ghana partners playing unique and complementary roles within this collaborative model. As I mentioned, Ghana Health Service is leading this partnership. They identified the primary health challenges to be addressed, facilitated the co-creation workshop with partners across the Ghanaian health ecosystem, and will continue to provide guidance and oversight throughout the rest of this funding cycle. USAID's Ghana Mission and their Center for Innovation and Impact developed the CIP initiative and have been essential in supporting the design and launch of this Ghana pilot. Grand Challenges Canada is providing the grant funding for this pilot and will be contributing its experience and resources to support the partners, applicants, and eventually innovators throughout the funding cycle. Finally, AMP Health has embedded a management partner within the Ghana Health Service. Many of you may know Chioma, who's joined our call today, to act as the in-country coordinator of the CIP Ghana and help bolster the broader innovation ecosystem in the country. And so where does STARS and Global Health fit in, and why the heck am I talking to you today? So the STARS in Global Health portfolio is Grand Challenges' flagship portfolio to test the potential of new pipeline in areas of strategic interest for Grand Challenges Canada and our funders. It's designed as a flexible portfolio to allow adaptability at each round of funding to meet the most salient development needs. The STARS program also provides responsiveness to changing global priorities with an ability to fill funding gaps and collaborate with key stakeholders to advance specific goals. In the case of this RFP and the pilot phase of the CIP in Ghana, the STARS and Global Health program at GCC is serving as the mechanism through which the RFP application and review processes are being facilitated, and through whom selected innovators will be contracted and funded. However, the complete funding cycle from application intake through review, selection, funding negotiation, and onto project support will be managed collaboratively by the CIP Ghana partners. Overall, applicants, reviewers, and eventually innovators can expect to work closely with our STARS and Global Health team as the representatives and faces of the CIP Ghana partners throughout many steps of this funding cycle. So let's talk a little bit now about the RFP itself and the areas of focus. So through this funding call, the CIP Ghana partners seek bold ideas to support Ghana's ambition to increase access to quality maternal and newborn health services. This will support Ghana's ultimate goal of reducing maternal, perinatal, and neonatal morbidities and mortalities, reducing direct obstetric case fatality rates, and reducing the rate of stillbirth. These innovative solutions are expected to address key challenges in the accessibility and delivery of maternal newborn health services at the sub-district level within the networks of practice in 6 regions in Ghana: Western, Upper East, Upper West, Northeast, Northern, and Savannah regions. Overall, the CIP Ghana partners seek transformative ideas that lead to at least one of the following 4 priority outcome areas. And you'll note that these priority outcome areas align specifically with the challenges identified by the CIP Ghana partners and other ecosystem players during the co-creation workshop. So those 4 priority outcome areas are: 1, improved communication and real-time tracking of information along the patient referral journey for mothers and newborns. 2, increased accessibility and availability of transport for pregnant women and mothers of newborns to reach health facilities, especially in emergencies. 3, improve skills of healthcare workers to deliver high-quality emergency maternal newborn health services. And 4, increased availability of essential medicines and supplies for maternal newborn healthcare where they are needed. Now let's talk about anticipated outcomes. So the CIP Ghana Partners define the proof of concept stage as when an innovation is field tested in a real world pilot to assess its potential technical, organizational, and financial viability. Proposals must include immediate, intermediate, and ultimate outcome indicators, and a description of how these will be monitored and evaluated over the life of the project. A reminder that proposals should focus on the actual 12 to 18-month period, not beyond, even if there is intention to carry some of that work forward with other funding. In a successful proof of concept, the CIP Ghana Partners expect to see, first, evidence that the innovation leads to at least one of the priority outcome areas. Again, these are outlined in section 2.1 of the RFP, and examples of specific outcome indicators can actually be found in section 2.6 and appendix B of the RFP. Second, for a successful proof of concept, we expect to see in the final reports that there is early thinking developed on the feasibility of and potential strategies for how the innovation can be sustained in at least 2 target regions. Third, we expect to see progress towards demonstrating evidence of demand from key stakeholders impacted by the project. This might be mothers themselves, it could be frontline healthcare workers, or it could be even the Ghana Health Service themselves. Additionally, the proposed innovative solutions are expected to address key challenges in the accessibility as well as the efficient and timely delivery of maternal newborn health services at the sub-district level within the networks of practice without creating an additional resource burden on an already strained healthcare system. All right, some key information on the specific funding opportunity outlined in this RFP. So the award amount to each project is expected to be in the range of 200,000 to 250,000 Canadian dollars. That's an important note. The budgets that you submit in your proposals must be in Canadian dollars. We absolutely understand that selected innovators will likely be implementing in another currency, whether that be the Ghana cedi or the US dollar or what have you. And Grand Challenges Canada is absolutely able to make funds transfers in other currencies necessary to be received by a project team, but the budget needs to be completed in Canadian dollars initially. The timeline of expected awards is anywhere between 12 to 18 months. And we expect to select and award approximately 10 proof of concept awards throughout at the end of this selection period. A reminder that the geographic scope of project implementation must be within the 6 target regions of Ghana. These are Western, Upper East, Upper West, Northeast, Northern, and Savannah regions. A reminder, as outlined in the RFP, that applicants are expected to be able to implement in 2 regions throughout the life course of the project. In the application, you'll see that you are asked to select your top 2 to 4 implementation regions. And there may be some reshuffling once we go through the complete application and review period. Ghana Health Service may reach out to certain teams to request whether they might be able to implement in different regions based on a goal to have sort of balanced implementation across the various regions. Finally, the target users of these proposed solutions should include women, children, adolescents, healthcare providers, and or health facilities in communities within the target regions in Ghana who are unserved or underserved by current approaches. To be clear, you don't need to target all of these categories of populations, but your target users must include at least one of these categories. Okay, before we move on to sort of the eligibility and review process, an important reminder about deadlines. There are 2 deadlines to consider here. If you have never applied to Grand Challenges Canada for funding before, you will need to create a Flux account. The deadline for registration is July 26th, 2023. Then the application deadline, so that can be once you have received your registration details, or if you already had existing registration details, the application deadline for the submission of the proposal is August 2nd of 2023 at noon Eastern Daylight Time or 4 p.m. UTC. Let's move on now to the review period. So first, let's cover eligibility criteria. These are some highlights. The full set of eligibility criteria are found on pages 17 and 18 of the RFP document. Please, please, please be sure to review that in great detail. Don't waste your time. Ask the relevant questions to ensure that your entity and your proposed project will be eligible. So first, when we consider what institutions are eligible, so only legally recognized organizations such as social enterprises, non-governmental organizations, nonprofit organizations, for-profits, and LLCs, as well as research and academic institutions are considered eligible entities. These entities must be formed and legally incorporated in an eligible country. In the case of this RFP, eligible countries of incorporation include Canada, as well as countries within Northwest, East, Central, and Southern Africa. Institutions must also be considered active and in good standing with their respective registration bodies in order to be considered eligible. And they must also have the capacity to enter into contract to receive and administer foreign funding and successfully perform activities in their technical area. Please note that Ghana Health Service bodies are not eligible applicant entities. Ghana Health Service bodies could be collaborators, but the application would need to be submitted with a partner organization as the lead and primary grantee. So for proposals to be considered eligible, there must also be a complete application submission. This means that the registration and application must include all required information, have all questions addressed, and be submitted in either English or French. Finally, the geographic scope. As clearly outlined in the RFP, proposed projects must seek to implement in Ghana, specifically within 2 of the 6 target regions. Again, these are the Western, Upper East, Upper West, Northeast, Northern, and Savannah regions. And applicants will be asked to identify their preferred implementation regions within the application form. All right, so moving on to the actual review process. So the eligibility screen is, as the name implies, a screening to ensure that all applications meet all of our eligibility criteria. The next step in the review process is the innovation screen. And so again, a complete description of the innovation screen stage is found on page 18 of the RFP. An important note here is that only a subset of application questions, those marked in the actual application form itself with an asterisk, will be read at this stage. So please ensure that these questions are adequately addressed. You'll be, at this stage, proposals will be screened for relevance and for innovation. And the criteria are outlined here on this page. Next, a subset of proposals that were successful through the innovation screen will then move on for a full comprehensive review at the external peer review. Again, a complete description of the external peer review stage is found on pages 19 and 20 of the RFP. This includes the complete evaluation criteria that will be used by reviewers. The categories of these criteria include impact, innovation, project execution plan, leadership capability, and value for effort. These map on quite closely to the application form itself, and we highly suggest that applicants review the peer review evaluation criteria as they complete their applications so that they're aware of the details that reviewers will be looking for. Now, quickly, what we will not fund. So projects involving establishing proof of concept of innovations for which the core intellectual property rights are owned by a third-party institution, we won't consider unless the third party grants the applicant sufficient license rights to the innovation to permit eventual scaling in low and middle income countries, or signs an undertaking to comply with Grand Challenges Canada's sharing and access for impact strategy. Additionally, we will not fund projects that are similar to ones Grand Challenges Canada or other funders have already supported. So please review Grand Challenges Canada's searchable database of funded innovations that I'll link on the next slide for more information on previously funded projects. To clarify here, adapted delivery models are perfectly valid and innovative if you can make the case that the implementation context is sufficiently distinct from where an innovation may have been previously tested. Again, this could be considered innovative given the differing context. You know, if something has been tested in a urban setting and you would like to test it in a rural setting, or it's never been tested in a population with displaced persons, for instance, if you can make the case for the context being sufficiently distinct from where it was previously tested, generally that will meet sort of our the degree of innovation that we're seeking. Finally, projects implementing outside the 6 regions of focus of the CIP Ghana will not be considered, and projects that are focused strictly on capacity building and or advocacy and do not involve the actual testing of an innovative proof of concept will not be considered for funding either. So I mentioned that GCC has an innovation database. So this is where you can ensure whether GCC has already funded something similar or the same as the innovation idea that you'd like to present. Now on to some application tips. So first, be mindful of the character limits, especially if you are preparing responses outside of the Flux portal. Only be highly descriptive when it's necessary to convey the key message. Otherwise, concise answers are best. Character limits include spaces. Be cognizant of that. We suggest that you respond in a narrative format rather than in bullets so that you can really convey the story and the message to reviewers. We ask that you address all parts of each question, so read the questions carefully. Some questions have multiple components and all sections are required to successfully submit the application. And then be sure to take note of the questions with the asterisks. As I mentioned before, these questions will be the only ones reviewed at the innovation screen step, so be sure that you've taken particular care in providing strong and complete responses to those questions in particular. Now, quickly, what to expect if you've never looked at GCC's Flux registration portal before. So the link at the top of this page here will take you to the sort of Flux landing page for Grand Challenges Canada. If you have an existing account, meaning you have applied to GCC before, or you've investigated whether that is of interest to you, you've registered before, you can log in on the left-hand side here. If you forgot your password, there's a function to reset your password. If you have never encountered GCC's Flux platform before, you are going to need to create a new account, and a reminder that that deadline for registration is July 26th. So you can go ahead and click the Create an Account button. If you encounter any issues, you can reach out to technical support. Once you have created or identified your existing login details, you'll go ahead and log in, and you'll come to the page as seen on the right-hand side here. So there'll be a menu on the left-hand side. On the welcome page, this is the landing page you'll see where it outlines the current funding opportunities for GCC. There are currently more than one funding opportunity open, so please be sure that you select Start New Application for the Country Innovation Platform opportunity specifically. That should be the first one listed, but please just take a look. Then once you start a new application, you'll be brought to that application page, and you will easily be able to begin entering details into that page. You can save and come back. You can save and come back to the application up until the application deadline. Submit before the deadline, leave yourself some time in case you encounter any technical issues. If we don't have demonstrated evidence of an attempt to submit before the deadline, we won't be able to help you. If you can demonstrate to us that you've been trying and encountering issues before the deadline, we can usually help you sort that out. Finally, just a reminder, we have posted this in many places, but all applications must be submitted through the Flux portal. We cannot accept applications through email or other methods. It must be through the Flux portal. Excuse me. Okay, once again, sorry about that. Once again, I just wanted to direct folks to the Stars in Global Health web page on the Grand Challenges Canada website, and remind you that this session is not meant to be a replacement for a thorough review of the RFP or the FAQ or the application questions. So please be sure that you are thoroughly reviewing those documents, ideally with collaborators and team members. And we'll now move on to the final portion of this webinar session, the open question and answer period. If you've not done so already, please add your questions to the chat or use the raised hand function in Zoom, and we'll call on you to unmute yourself. And when asking a question, please feel free to turn your video on if you've not done so already. I am going to stop sharing my screen and end the slideshow so that I can better see the participant group. And answer any questions that have come up throughout this presentation. So as I said, please feel free to add your questions, comments in the chat, or use the raise hand function, and we'll call on you to come off mute. I see that there's a question about whether this recording will be shared. Yes, we will post the link to this recording on our Stars in Global Health website. Miriam, we will also share it with those that registered for this session. So let's remember to do that. So you'll get a notice of it as well. So the floor is open to all of you. I see a question from Leonard. Can the National Blood Service, not technically a GHS entity, but a government body, apply as principal? Leonard, is the National Blood Service registered and incorporated as a distinct entity from the Ghana Health Service? please feel free to come off mute. Essentially, the short answer here is that if an entity is independently registered from GHS, then it shouldn't be a problem. If they are sort of a subsidiary, that's when we might encounter issues. And if you have specific questions about that, that's something that we'll discuss with our Ghana Health Service partners, and we can perhaps investigate this with your specific entity if it's unclear to you. Darlington, please go ahead.
Okay, so my question is, in a part, it says you should demonstrate capacity to be able to enter into a contract and receive foreign funding. Can you please break it down to like layman terms for me?
Darlington, if I heard you correctly, the connection was a little fuzzy. So if I heard you correctly, you're just wanting clarity on what it means for an entity to be able to enter into contract and receive funding. So this is really comes down to the type of entity that you are seeking to apply through. And what we're looking for is to ensure that the entity that you're applying through is appropriately incorporated and registered. So they have, relevant incorporation documents from, if you're a Ghanaian entity, the Ghanaian government, if you're a Nigerian entity, the Nigerian government, for instance, to ensure that you are appropriately legally established and therefore able to contract with GCC. What we see sometimes in certain requests for proposals is that entities like community-based organizations might apply. And in some countries, community-based organizations don't have sort of registration frameworks at the federal or even regional levels to ensure that they are, formally and legally established and monitored in certain ways. And so they may not be eligible. If you are a registered nonprofit, a registered for-profit, you are very likely able to do that. So I would suggest that you speak with the administrative or legal staff within your entity to confirm those details.
All right, thank you, Dominic.
Not a problem. Leonard, I see that you lost connection, but you're back. So Leonard, the National Blood Service, my question was whether the National Blood Service is incorporated as a distinct entity separate from the Ghana Health Service. If they are registered independently, then yes, you are eligible to apply. If the National Blood Service is a subsidiary, or sort of if the GHS would kind of serve as a parent, then it's unlikely. If you have more details, you can provide us offline. This is something that we can follow up with our colleagues at the Ghana Health Service to ensure we have clarity for you if you're not sure based on that answer. I see a question from Marina. Is it necessary to find a co-funder? This was touched upon in the grant description document. So in the FAQ, the frequently asked questions document, we expand on this a little bit, but co-funding is not a requirement to be eligible for funding through the CIP Ghana request for proposals. So no, that is not necessary at this stage. If your proof of concept were successful and you were to seek further funding from GCC in the future, which is not guaranteed but possible, then co-funding at the transition to scale team would be required, but not at this stage through this RFP at the proof of concept level. Osai, I'm not pronouncing that correctly. Please correct me.
Yeah, Osei, my name is Osei.
Osei, thank you.
Thank you so much, Dominic, for the explanation. So my question is, can you apply with another organization? In other words, can you partner with an organization to apply together?
Yes, technically yes. So we're fine to have collaborations, but one of the entities is going to need to identify themselves as the primary, like as the lead applicant. And the details of that organization and a lead from that organization will need to be the ones that you reflect in the application document. There's a section in the application document. It's one of the first sections that lists it's a section called collaborators, and that's where you would give us the details of the partner entity and where you might wish to just briefly explain sort of the relationship between the two entities. In the budget section, you'll note that there's also sections for like budget sections for subcontractors as well as sub-grantees. So a partner entity could also receive funding. The primary grantee would be responsible for distributing that funding to the sub-grantee, so to the partner entity. But yeah, so overall, yes. Do you have any follow-up questions on that?
Yeah, so my follow-up question is that for let's say the other collaborator, does the organization need to be also registered or have legal registration?
That is a tricky question, because while GCC would not be contracting directly with that entity, that entity would need to be able, essentially, the primary applicant would need to have an agreement, so maybe an MOU with that partner entity. And that MOU would have to reflect that that partner entity has read and reviewed the grant agreement that the primary is signing with GCC and agrees to essentially, as a sub-grantee and partner, uphold those obligations.
Okay, sounds good.
If you're looking into this and still have follow-up questions, I think my suggestion would be to send us an email and provide a little bit more of the specific details of who the primary and who the sub are, and then we can engage our legal team to see if they can provide any additional guidance on that. Yeah, that's the best I can do right now. I think it's our preference is that yes, they are, especially if they're going to be a sub-grantee, that they are a kind of formally recognized entity. I think sometimes the workaround there might be, instead of engaging the entity, you engage individuals as subcontractors. That can be so then you're engaging that individual, right, and bringing in their expertise. So that might be a reasonable workaround for that potential issue.
Sounds good. Thank you so much.
Not a problem. Okay, I see another question from Leonard here in the chat. Can a for-profit founded and registered in the US but with local subsidiaries also registered in Ghana apply? That depends on how the subsidiary is registered in Ghana. If they are registered as an independent entity in Ghana and don't require sort of the sign off and regulation of the American entity, then yes. If they are, generally when someone uses the language subsidiary, it's almost certain that they would not be eligible because they are unlikely to be an independent entity. Leonard, does that address your question? Okay, great. I don't see any other questions in the chat or hands raised. So if you have one, please feel free to jump in here.
So I do have another question.
Absolutely.
So the other question is, does the idea have to pass the proof of concept, or it could just be an idea to apply?
So that's the purpose of this funding call, is we're keen for new ideas to come out, and the funding would be for you to actually implement and test the proof of concept. So I essentially, by the end of the funding period, to be able to demonstrate whether or not the idea actually had the intended impact on the target population. So it absolutely can be an idea. It just needs to be that the idea will be feasible to develop, implement, and evaluate within the scope of the maximum 18 months and 250,000 Canadian dollars, tested in 2 regions of the 6 target regions. And maybe an additional clarification to the full group here is that when we say testing in a target region, you don't need to be testing across the entire target region. It can be a sample community or sample population within a particular region. The desire to get into testing into 2 regions is the recognition that even these 6 regions have a lot of diversity. And so the Ghana Health Service is keen to be testing in multiple places through this funding.
Sounds good. And in that case, is there any specific number of people that, or the population that the idea needs to be tested on? Like, can we just maybe test it versus 20 versus 100, or like, is there any minimum number of people?
There's no specific minimum. I would suggest that you consider whether, we talk a lot at GCC about depth versus breadth. So depth, is the innovation you're seeking to implement going to have, a transformational impact on any particular individual that it's engaging? Is the depth of impact really significant? Or are we talking about a type of innovation that is really going for, maybe shallower depth of impact, so the sort of a lighter touch impact on each individual participant or user, but is able to reach a broad, population group? If your intervention is meant to have a really intense depth of impact, you probably need to test it with a smaller sample size. If you're looking for breadth of impact, you probably want a larger sample size. What we would suggest is that you conduct some literature review and you look into similar innovations to assess what, sort of the recommendations, what other evaluation protocols have done and things like that. And remember that sort of the value for effort is going to be one of the criteria assessed at peer review. So the reviewers, who are technical, business, innovation experts, need to be convinced that you're testing within a sufficient, sample size to actually be able to relatively confidently say that, yes, we have demonstrated this impact. So there's a little bit of sort of research work on your part, and then sort of explaining why you feel that sample size is sufficient so that the reviewers are feeling confident about that.
Sounds good. Thank you.
Not a problem. Gracia Aboud, please go ahead.
Hello. I missed a little bit of the presentation, so I don't know if you already covered that question. Can a group of students apply with supervision of academics?
If you apply through your academic institution, the students could make up the project team. Yes. You would need administrative support from your institution to apply. The entity that you're applying through would need to be the academic institution. And so as long as that academic institution is incorporated in a relevant jurisdiction, so that's Canada, North, West, Central, and Southern Africa, and East Africa, then you're good to go.
Okay, thank you.
Not a problem. Darlington, I see that you've come onto video. Do you have another question for us? I see in the chat, Nee has, oh, you're welcome to stay on video, Darlington. I'm sorry, I didn't mean to scare you away. I just wanted to offer you the floor if you wanted it. I see in the chat, Nee has mentioned, my assumption is all applications will interface with the Ghana Health Service during implementation. Is the preference to partner with a specific unit or division, or this is guaranteed during the implementation? So, yes, it is almost certain that that the implementation will include engagement with Ghana Health Service or other health sector bodies, especially given the need to align implementation with the rollout of the networks of practice. There is no preference to partner with a specific unit or division. I think we would expect that in your proposal, you can identify sort of what you're anticipating, where there may be already existing relationships, and where you would need support in sort of developing any relationships or engagements. That is one of the real strengths of this new model, this country innovation platform, is that the Ghana Health Service is a lead partner in all of this. And so all of the rest of us partners will be working with guidance from the Ghana Health Service to ensure that selected innovators are supported to actually meaningfully engage within the health sector with the public system. And so while it's important to identify where relationships may already exist, I think it's equally important to outline where you know, the partners may be able to step in and provide introductions or connections that will be essential to your implementation. And then I see Nee has also asked, what is the basis of measurement of impact, project output, or third-party analysis post-project? So we definitely expect that there will be strong monitoring and evaluation throughout the life cycle of the project, and that innovators are able to demonstrate proof of concept by the end of the project period. So certainly it would include project output, and you can refer to the sections of the RFP that speak to anticipated outcomes and indicators. Again, in the application, you'll be expected to speak on the project execution plan, which should include plans for monitoring and evaluation, as well as results, which should include indicators at the immediate, intermediate, and ultimate outcome level. Okay, a question from Leonard here. Are innovators already working with GHS but want to scale these interventions to these new regions apply? So this is not a call for scaling support. This is a call to test new innovations that align with the identified challenges and areas of focus. If you have implemented an innovation, even if it's in collaboration with GHS, in one of the regions that is not one of the 6 target regions, and you can make a case for the fact that where you have already implemented is a sufficiently distinct context, and we know that those 6 regions were selected by GHS as a result of them being, having particularly deep challenges and very specific implementation context. If you can make the case that it's only been tested in a very different context, then you could apply to implement it in this new context within one of the 6 regions. And that's how we would sort of, even if it's a replication, that's where we would consider it to still fall in the proof of concept sort of category, as we would expect you to evaluate the impact once again within this new context. All right, we have 8 minutes left. So if you have any final questions, please be sure to share them. Okay, Leonard, I'm really glad that that was a helpful and clear response. So great, thank you. Yeah, please feel free to add any final questions to the chat or just jump off mute here and ask them live. A question from here. Do you have any tips on how to create an application that stands out? Not any, no more than what I've already shared. You know, answer the questions to the best of your ability. Ensure that you're communicating in a succinct manner. This might require revising your responses a couple times to sort of tighten them up and make sure that you're in a brief period, in a brief response, sort of adequately conveying your message. Take some time, don't rush through this. Work with, you know, other team members and collaborators to ensure that you're sort of getting different perspectives on the questions that you're answering. That's what I've got for you. Darlington, please go ahead.
Okay, so my final question is, for example, there may be two innovators in the same group or in the same application that are doing different things, but you believe that you can collaborate on certain aspects to actually move each other's innovation. So your applications are separate, but you feel like there's a need for both of you to collaborate on some certain aspect of it. Is it also allowed?
Yes, I think it's allowed. I think what I would caution is if you are submitting separate applications, you would need to ensure that your application can stand alone. So each application is going to be reviewed individually. So you would need to ensure that your application meets all of the requirements. You know, you've answered all of the questions, that you meeting the evaluation criteria as well, in a way that you feel confident that you could be selected, each application independently. If the ideas are so reliant on one another, I would strongly suggest a partnered application where one of the entities is the primary applicant and then the other is listed as a collaborator for now and becomes a subgrantee. Because if they're reliant on one another, they should be evaluated together. Does that help clarify, Darlington?
A little bit. Maybe perhaps I could provide a little bit more context on it. So, for example, one of the target areas is for referrals, and one is also for delivery of pregnant women to in case of emergencies. So someone may be targeting, or someone's innovation may be targeting referral, but someone's innovation may be targeting, for example, transportation.
Mm-hmm.
But then they could work independently, but they feel that, okay, although we can stand out independently, we can still collaborate on certain aspects.
Yep.
That's where I'm coming from. Yeah.
Yeah, no, I hear you. And I think, like, if they could stand alone, I would still say submit separate applications, and then you could include in the, you know, collaboration section, perhaps. I think that's probably the most relevant section to put this in. But you could indicate, you know, you could even include the application ID of the other one if you're able to know it and indicate what entity it is and whatnot. and just provide a brief summary of like, if you were both selected for funding, this is how we would suggest working together. And if you were both selected for funding, we would certainly, as the CIP Ghana Partners, find ways to enable that collaboration and partnership. But we don't know whether either or both are going to get selected, right? So I think if you think that it's a greater likelihood that you're going to be successful in the review and selection process if you submit together, then do that. If you feel strongly that they could both stand independently, but in the long term benefit from, you know, collaborative implementation, then I would suggest separately. Is that a little bit more clear?
Crystal clear.
Great. All right, well, we are coming to the end of our time together. As we mentioned at the outset of this, the recording will be uploaded to the Stars and Global Health webpage. We'll also, once that's done, we'll email a link out to all of those who registered for the call today. So everyone on this call and those who were ultimately unable to join, we'll send that all out. There will also be another Q&A session, though we won't do the full presentation because that's been recorded and available. We'll do another Q&A session in a couple weeks. If you have any other questions that come up during that interim period, please feel free to join again. And with that, we will once again say thank you so much for joining us. Feel free to reach out to the Stars and Global Health team at any point. Gloria's just put that information in the chat. Thank you. And yeah, share your questions with us there if you're unable to find answers within the key documents, the RFP, the frequently asked questions, and the application form. So with that, we'll close. Thank you, everyone, and have a great rest of your day. We look forward to reviewing your applications over the next little while. Bye-bye.
Bye.